This lecture will cover socio-emotional development in infancy. The picture on your left shows a caregiver with her child, and socio-emotional development involves the personality of each of these individuals as well as the relationship or emotional bond that exists between them. We'll first begin by discussing general emotional development in infancy. Then we will discuss the topic of temperament and attachment. Emotions are defined as physiological and behavioral reactions to the environment. It's important to understand that certain environmental stimulations can cause physiological changes that associate with behavioral reactions, such as smiling or signs of fear. And of course, with signs of fear or happiness, there are going to be physiological changes at the neurological level that involve neurotransmitters as well as different regions of the brain. Emotions are critical for human interaction. They assist in our communication with one another. They allow us to identify people's emotions and communicate with them effectively, as well as organize our behaviors for appropriate situations. We have to behave in a certain way at a funeral versus the office, or when we are hanging out with our friends or just trying to have a good time. There are just different ways that we communicate and behave based on different situations. With regard to the relationship between a parent and infant, emotions can both support or harm attachment formation. When a caregiver is displaying positive emotions such as happiness and joy, children are more likely to feel comfortable and secure in that kind of a situation, as opposed to a caregiver who is experiencing emotions such as depression or fear or anger. A baby is unlikely to be able to feel safe and secure, and therefore that is not likely going to support or promote a secure attachment. Emotions are a function of the limbic system. The limbic system is a group of structures in the brain that includes the hypothalamus, pituitary gland, amygdala, and hippocampus. So the hippocampus is a structure that's strongly associated with memory formation, specifically episodic memories and other types of explicit memories such as personal experiences and pieces of factual information. The amygdala is responsible for emotional regulation, specifically for fear and anger. And therefore, because they're very closely tied to one another in the limbic system, it's our most fearful and angry experiences in life that are actually going to be the most memorable. This has an evolutionary advantage so that if we are ever in these positions again, we will be able to remember how we dealt with them the first time, and that should, in theory, assist us in surviving or basically dealing with the situation again. This can be maladaptive, of course. We have individuals that face traumatic experiences in which they are in extremely fearful or anxious situations, and they have very vivid memories associated with those experiences. The problem occurs is that some of them are unlikely to ever experience those situations again, and therefore struggle to adapt towards civilian or quote-unquote everyday normal lifestyle because there are certain experiences that may trigger those memories, and that can lead to really strong emotional outbursts, specifically with regard to anger and fear, which would be maladaptive, for example, in the workplace, or for trying to communicate with someone in a professional environment, or just in an emotional situation. The pituitary gland is also referred to as the master gland of the endocrine glandular system. It is responsible for stimulating all of the other glands in our body, including the thyroid gland, the pancreas, our adrenal glands. And so therefore, when we are in angry or violent situations, those glands are likely to be more active. The hypothalamus connects the pituitary gland to the rest of the brain, and so therefore, in order for us to the pituitary gland requires the hypothalamus to communicate with the rest of the brain in order so that way we can process visual and auditory stimuli and whether or not we perceive them as fearful or threatening. Displayed here are the 6 primary emotions that are present in humans and other animals, specifically primates, that emerge very early in life. These emotions were made famous in an animated movie called Inside Out. So some of the primary emotions include fear, anger, joy, surprise, disgust, and sadness. And so starting at the top left, we have a woman who does not look very happy. That is because she is showing signs of anger. And it's important to understand that infants can display anger as well, and they will show these common facial reactions. So it's important to understand that these emotions, these primary emotions, have a very strong biological basis to them. The man on her right is showing signs of fear. You can see his furrowed eyebrows and his open mouth. The woman on his right or excuse me, that would be his left. On the far right, she is showing signs of disgust. The woman on the bottom left is showing signs of surprise. The man at the bottom, on the bottom row, he is showing happiness or joy. And then the woman at the bottom right is displaying signs of sadness. Self-conscious emotions are types of emotions that require self-awareness and do not appear until toward the end of the first year of life. And so self-conscious emotions require the infant to have an understanding that they are a unique individual and that they have a relationship with other people like their primary caregiver, and their primary caregiver has other relationships as well, such as to their siblings, or other responsibilities that they need to tend to. And so self-conscious emotions again require basically an awareness of the self, that we are a unique individual in the world, and people have multiple relationships with one another, and therefore those include emotions such as jealousy, embarrassment, pride, shame, and guilt. So emotional expression during infancy involves a lot of crying, smiling, and fear. So there's a lot of different patterns that we've observed in crying within babies. Basic crying seems to be pretty, I guess, rhythmic in a sense that there's a steadiness to it. The more angry a baby is, the louder they are likely to cry. The basic crying is typically associated with some sort of discomfort, such as maybe some sort of gas or hunger. Babies that are angry, they will typically basically scream louder, which is mostly true for all humans. And then painful crying, when children are in pain, they typically will basically sometimes hold their breath and not be able to breathe. And so many times you'll see them actually kind of start to turn very red or almost even blue because they restrict oxygen to themselves. Smiling, one of the things that we notice with babies is they can smile reflexively anytime they feel good or they feel pleasant or they're experiencing some sort of stimulation that is pleasurable to them. Social smiling involves basically a response to an external stimulus such as a parent or a caregiver. Sometimes they can essentially smile when they see someone else smiling. We see a lot of fear in infancy. We see stranger anxiety appear at around 6 months of age. And it's important to remember that during the first 4 months, children are kind of just drifting in and out of consciousness. They spend very little time awake. And so they are still struggling to be able to form connections and identify an individual as a primary caregiver. Separation protest, this basically is an experience that infants have when their primary caregiver leaves. And so they start to form an attachment with their primary caregiver, somewhere around 6 or 7 months, and with that comes fear of others, and as well as basically fear of being separated from their primary caregiver. So temperament is a term that describes the difference in emotional responses and sensitivity to changes in the environment. It's essentially some of the early, very strongly biologically influenced signs of personality. So part of our personality is how we deal with stress. And some of us deal with stress better than others, and that can be said for babies as well. Easy babies are babies that are typically happy. They are not very easily bothered or irritated or disturbed. They sleep fairly regularly. They're able to soothe themselves to sleep. They have fairly regular eating routines as well. They typically don't resist eating, and they typically don't experience lots of signs of disgust. And they adapt very easily to new situations. They enjoy trying new foods, and they don't mind being taken into different environments, taken outside or being exposed to different temperatures or different levels of volume in the environment as well. On the opposite end of the spectrum, we have difficult babies. Difficult babies cry frequently. They struggle to fall asleep. They're very sensitive to changes in the environment, such as loud sounds or bright lights. And then somewhere in the middle, we have slow to warm up babies. These babies are typically just have a lower activity level in general. They're not very active. They're not very aroused. And it takes them a little while to adapt to new situations. And so it's best to basically gradually I guess, expose these children to changes in the environment if possible. Goodness of fit is a term that describes the relationship between the child's temperament and their environmental demands or their caregivers' demands. One of the topics that we looked at in physical development of infancy was shaken baby syndrome. And so shaken baby syndrome is a situation in which a caregiver is typically impatient and aggressive and inexperienced and essentially emotionally unstable. And they often get very frustrated with a baby who won't stop crying. And so out of frustration, they often shake the baby. And so a caregiver who's impatient or emotionally unstable or prone to aggression would be a very bad fit with a difficult baby, because a difficult baby cries very frequently and can be very essentially annoying, if you will, to a caregiver who's not responsive to their needs. Whereas a difficult baby being paired with a very, very loving person who has a lot of patience and care and sensitivity, that would be a good fit for that baby's personality, that baby's temperament. An attachment is an emotional bond that exists between two people. There are different theories that attempt to explain why or how attachments form or take place. Sigmund Freud's theory of attachment is driven by basically oral stimulation and oral satisfaction during the oral stage of life, the first 2 years of life. And so Sigmund Freud believed that the primary factor that was associated with attachment formation was essentially feeding the child. Whoever fed the child, essentially the child would become most attached to, because in theory the child needs food to survive, and so that's what makes them form an attachment with them, which makes a lot of sense in theory. Harry Harlow's study, however, offered some contradiction to that theory. Harry Harlow's study is very famous. He essentially separated baby monkeys from their mothers, and they were raised in a controlled environment where they had essentially two surrogate mothers. And these surrogate mothers were non-living things. They were essentially, one was made out of wire. It was basically a wire structure that resembled a monkey, and the other was a cloth figure that resembled a monkey. Now, the major difference between them, besides their sense of touch, if you will, or the amount of contact comfort they provided, was the fact that the wire mother provided a food source, whereas the cloth mother did not. And what he observed was that monkeys would only go to the wire mother for food and would spend basically all of the other time with the cloth mother. Furthermore, Harry Harlow would expose these baby monkeys to stressful situations like strange environments or machines that made loud sounds, and when the monkeys would become fearful or stressed out, they would run towards the cloth mothers. And there's a lot to be said there about, when we experience stress or stressful situations, the people that we go to are typically the people who are going to provide us with some sense of emotional security. But Harry Harlow believed that the driving factor was contact comfort. And so when you consider Sigmund Freud's argument about feeding, well, you also have to understand that Sigmund Freud's theory was developed, well over 100 years ago, before the invention of formula. And so therefore all babies were breastfed. And so that contact comfort that existed while a mother was breastfeeding her child, Harry Harlow believes that holding the child and basically that skin to skin contact was actually more important than the food source. Erik Erikson's perspective is essentially a little bit more complex. He believed that attachment was built on a sense of trust and a sense of care and security. And so these broad terms incorporate: one, feeding a baby when they're hungry; holding them when they want to be held; picking them up when they want to be picked up; providing them with stimulation when they want stimulation; and also not overstimulating them when they require some time to essentially sleep or rest. And so Erik Erikson kind of took a more well-rounded approach towards describing the attachment process between a caregiver and their child. The strain situation is an observational research procedure that was developed by Mary Ainsworth to study the attachment process and the attachment formation. Well, not so much the formation, but the basically what were the behavioral signs of attachment once it existed. So a secure attachment is a term that's used to describe the vast majority of attachments between a parent and their caregiver. The parent and their child, because the vast majority of parents or primary caregivers, I should say, do take strong care of their children, and those children end up forming a trusting relationship with their mother or with their father, whoever it is that's their primary caregiver. And so with the strange situation procedure, the way that it would work out was that a mother and her baby would go into an environment such as what looked like a waiting area or a little play area with toys on the ground. And the baby would basically explore the environment, play with toys, all while maintaining proximity to the caregiver or eye contact with the caregiver. If the caregiver moved across the room, typically the baby would crawl closer towards the caregiver. Furthermore, the baby would show signs of distress whenever the caregiver would leave. And then also, they would leave the baby in a room with a stranger. They would bring a stranger into the room, and the caregiver would leave, and the baby would become very distressed, and then the stranger would not be able to comfort the baby because the baby essentially did not have a sense of security or a sense of trust with the stranger. And then when the caregiver returned, the baby would essentially stop crying once they were reunited with the caregiver or the mother. And so these kinds of behaviors are what are most commonly observed in the relationship between a caregiver and their child. And this is basically a description of a secure attachment. A secure attachment is linked towards positive social skills like sharing and caring later in life, positive self-esteem, essentially feeling good about oneself and feeling like they're worthy of love, and also just general success in life, because I'm sure we can all agree that positive social skills and positive self-esteem, those can do a lot for an individual's success in life. Now, like I said, the vast majority, I would say 85 to 90% of children display signs of a secure attachment. There is a small percentage of babies that do not show a secure attachment with their primary caregiver, and that might be for many reasons, including the possibility that their primary caregiver does not provide them with a sense of trust, or does not give them enough contact comfort, or maybe does not feed them enough, Freud might say. There are different types of insecure attachments. Basically, they are all just different variations of how a baby might react that would not be like the way we described in the secure attachment. So as you can see in the insecure avoidant, babies may not really be interested in maintaining proximity or be distressed when the caregiver leaves. In an insecure resistant, we see babies that are very, very clingy to a caregiver, and they don't like to explore the environment, and so it's almost like they don't feel secure without the caregiver. They have extreme distress when the caregiver leaves, and then the return of the caregiver does not alleviate any stress at all. So this one's kind of like an anomaly in that it seems like they are almost too securely attached or too attached, but we describe it as insecure because it's basically maladaptive. And then we have some babies that basically don't fall into any category or pattern. In summary, attachment is driven by caring for and responding to all of the child's needs, feeding, changing, and holding. You could consider this, I would suppose, the Erikson take or the Erikson perspective. Caregivers must be consistent in these things. And attachment does not take place during one interaction. It takes place over several interactions. And then furthermore, insecure attachments may lead to difficulties in forming relationships later in life, as well as general patterns of low self-esteem. So it's very much the opposite of what a secure attachment leads to or is associated with. One of the social policies that is strongly linked towards attachment is basically maternity or paternity leave. There are some societies that offer extended maternity leave up to 6 months. We live in a society where maternity leave or paternity leave is pretty much decided by an employer. But basically, if a mother or parent is unable to take time away from work so that way they can form an emotional bond with their baby, then that might basically that's essentially if they're not around, if they're not able to spend time with their baby, they're not able to essentially develop a secure attachment with them. And I think as more research exists, we realize that having one attachment is not as good as having two attachments, and so therefore paternity leave is also a very popularly rising trend because research shows that when a baby has two types of secure attachment, a secure attachment with their mother and a secure attachment with their father, that just leads to a more likelihood that they're going to develop all those positive outcomes of having a secure attachment. And so this graph basically shows that stay-at-home fathers is becoming a rising trend, and there's a lot of factors that play into this. Educational opportunities and employment opportunities for women, and also just kind of a stronger awareness of gender roles and how some of them might be maladaptive, and realizing that, the idea of staying home and caring for children, that's not something that should be, strictly defined to the role of a woman. At least that's where our culture is going. Granted, there are some people that are going to disagree with that, but I think that there's no arguing that the culture is changing, and there's also no argument in saying that, as culture changes for the better, sometimes people get left behind, and they refuse to adapt. Anyways, that basically summarizes all of the topics associated with socio-emotional development in infancy.